Hi everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about the transition of value-based care and patient accountability. As healthcare kind of evolutionizes, if you will, we are transitioning from a fee-for-service type reimbursement atmosphere to a value-based care atmosphere. If you're not really sure about what that means, it just is where fee-for-service, you have your CPT codes, you have your diagnosis codes, you link them up, you put them on your claim, and you send it out and you get paid. Value-based care is about how well you provide the services, not what services you provide, but how well. What kind of avenues are you having to take with these individual patients based off their chronic conditions and their health needs? And then based on that, you get paid making sure that they are fulfilling the needs of their specific diagnoses. So if someone is a diabetic, you need to make sure that they're getting their eye exam. You need to make sure that they're getting their foot exams. You have to make sure that they're getting their regular checkups for their hemoglobin A1C and adjusting medications, things like that. The value in their care that they're getting, you're getting paid for, not just the fee for service, not just the service and getting paid. You're getting reimbursed based off basically how well you're providing the services for their individual needs. And I have a video about value-based care. It's a few years old, but it's not different. I mean, the basis of it is true. So check that out. But there's a huge kind of discussion going on in healthcare right now because value-based care has a lot of patient influence in it. Because if patients aren't following the instructions that their doctors are giving them, if patients are not taking accountability and being proactive or reactive if something's going on and not following the directions of their healthcare professionals, unfortunately, it can negatively impact the reimbursement to their healthcare professionals. And so it's like, okay, how do we start having patients be held more accountable for their health? Because right now, if you think about it in healthcare, as a provider, you are held at very high standards. If you participate in the MIPS macro program, if you participate in value-based care programs, you know that you can only do so much for patients, but they still have to take the next steps. They have to listen. And I feel like there are some areas for wiggle room there and consideration where the patients influence this. However, there still could be more. And in value-based care, you really want patients to understand their role in the whole process. And I wouldn't really come at it from a revenue type angle. However, that's a huge impact as a business of healthcare that you need to consider. One of the biggest ways to get patients to be held accountable is through the use of technology. Now, if you're in a specialty that you see a lot of older individuals that are not happy or comfortable with the electronic means of communication, patient portals, things like that, it makes it a little bit more challenging. However, there are some ways to be able to help these patients understand and maybe even teach them to utilize the platforms that are going to be the most beneficial for them and you. I think we're going to have to think outside of the box. I think that we're going to have to definitely advocate for ourselves with these government entities and insurance entities. Of course, nothing's changed there, but maybe have more involvement if you haven't yet when it comes to this kind of stuff. Now, technology, depending on the platforms that you use for your practice management, electronic medical record system, you might have things available to you that might cost a little bit more or are included in your package that you don't utilize. If you're not sure, you should definitely look into that. But there are third-party vendors out there that also integrate or interface with other EMR systems and things like that that could also assist you if your EMR practice management systems do not offer what you're looking for. A lot of people have been fast to adopt telehealth, which is great, and I think older generations as well, because it is making it a little bit easier for them when it comes to having to find transportation to your office and things like that. However, we know that telehealth guidelines are probably going to be changing in September for October 1st implementation, so we can't rely on that. But we can kind of pigeon-tail, dovetail, whatever, off of that and explain to patients that maybe the portal would be beneficial for them to communicate with your office, to provide your office with certain readings, numbers that you need to have and monitor on a regular basis. Maybe they would be willing to adopt using certain durable medical equipment that records the information that you need and sends it directly to their chart in your office, so it doesn't require a lot of their extra efforts. There is so much growing in the medical device era realm right now, and I think that we need to start utilizing a lot of that for our chronically ill patients if you're not already. This will definitely help with value-based care reimbursement. Maybe think about having some kind of seminar or training after hours in your clinic once a month to help patients that want to use the portal or want to utilize these kind of advanced technology tools and teach them, help them learn and feel comfortable using them. Because a lot of times people just say, no, I don't want to use it because it's something new they have to learn and they don't feel like they would be able to, or it intimidates them. If you try to hold these kinds of trainings, maybe they would be more likely to use them. Showing them that you have other support resources if they choose to use any of these advanced technological resources. Maybe have a dedicated person in your office that they can talk to help them troubleshoot. Like I said, scheduling after hours training sessions on site and on hands-on. Maybe having someone from the medical device company coming in and helping your patients who use some of their medical devices and answer their questions or help them troubleshoot. Things like this. We have to be willing to teach. We have to be patient. And if it's going to affect our revenue, it's going to affect our patient care. I feel like even though that may not be why you got into healthcare, to be able to survive in this different evolving way of being paid, you're going to have to be a little bit flexible. We have to hold patients accountable. We have to help them learn what their insurance benefits mean. We have to teach them what just the definitions mean of a deductible, a co-insurance, right? In-network, out-of-network. Patients don't even know the basics. And I know we get so busy that you're like, how am I going to find the time or the resources to help my patients? And that's a good question. Again, thinking outside the box. I have videos for patients to be able to learn some of this stuff. I've put that channel on hold right now just because I wasn't getting a lot of people watching it, but there are videos out there to help patients learn this stuff. And maybe putting it on in your office for them to watch while they're waiting. Maybe having a resource out there, and maybe there's a third-party vendor that offers these services directly to your patients that would help them. I don't know. But we're going to have to figure out as a whole in healthcare of how to adapt to this value-based care that everyone's trying to push towards while holding patients accountable and being able to keep our doors open and make the money we need just to be able to sustain operating as a business. It's just something to keep in mind. It's not something that is imminent, but it's definitely trending faster and faster from fee-for-service to value-based care. And there are things that we need to keep in mind as providers, as office managers, administrators. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit. Thank you for your time, and we'll see you next time. Bye-bye.